All right, welcome everyone. We're just going to give folks a couple minutes to join us before we get started. I see a couple more people joining us. This is great. Thank you all so much for being here. We're going to get started in just a minute. Maybe John, do you want to kick us off?
Yeah, absolutely. I see people joining. It's awesome. The numbers keep creeping up. So I'm going to be very brief, and then I'm going to hand it over to Maya. But wanted to just express a lot of thanks for all of you taking the time to be a part of this meeting today. So this is one of the virtual convenings of the consortium for the year. We felt like this topic of school avoidance was one that would resonate with a lot of people, and judging by the numbers creeping up in the participant list, I can see that that's true. Our hope here today is to be able to provide some strategies for understanding kind of the etiology of school avoidance, but also how we can address it practically, and some of the partnerships that can be established that can lend itself to getting kids back into school and engaged in care from the school. One of the things I appreciate about what I've learned from InStride is the real collaborative nature of the partnership between InStride and schools. And I know you'll hear from Maya some of the key kind of connecting points between InStride and schools that make for sustainable change, quality partnerships that allow for kids to make it back into buildings and to stay there. So I'm thrilled that you're here, Maya. I really appreciate it. And if anyone has any questions or feedback following the presentation, which will run, I think we're 1 to 2 today. Yeah, Maya.
That's right.
Great. And if people have questions, are they able to engage in maybe like the chat or drop in the Q&A?
Yeah, exactly.
Okay.
Feel free if anyone has questions as we go along, please do submit them through the Q&A function, and I'd love to help get your questions answered.
Awesome. Well, Maya, I'll hand it over to you, but thank you so much for being here. I appreciate it.
Yeah, absolutely. And thank you so much, John, for having us. It's an honor to get to speak to all of you today, especially about such an important topic. So I'm really happy to be here. All right. Well, welcome again, everyone. I'll start off with just a quick introduction. So my name is Maya Massing-Schaefer, and I am a clinical psychologist, and I'm also here as the Associate Director of Clinical Content at InStride Health. And here at InStride, we provide specialty virtual treatment to kids, teens, and young adults who are experiencing anxiety and OCD. And as I said, today I'm really excited to be speaking to you all about school avoidance, which is something that we've really seen a lot here at InStride and has really become more of a growing concern, both for schools and for families in recent years. And so I'm hoping that this will be helpful. But let me start off with an agenda and what I'm hoping to cover today. So we'll start off with some background on what school avoidance is and why it happens. And then I'll talk more about how we assess and really understand school avoidance. And then after that, we'll really focus on the process of gradual school reentry. And so there we're really focused on how we help students take those small gradual steps back to school. Next, I'll talk about how we work with parents and caregivers to support these students during this process. And then if we have some time, I'll talk about how we monitor progress along the way and troubleshoot some of those challenges that we know often come up when working with this population. So let's get started with some background. So, in order for us all to kind of get on the same page about school avoidance, you might hear me talk about school avoidance, or many of you may have heard the phrase school refusal. So, we might go back and forth speaking about those during this webinar, and we tend to use those interchangeably. And really, what we're talking about is when a child or a teen is avoiding going to school for an extended period of time and/or consistently arrives late or leaves early. And what this often looks like at home for families is kind of a long, intense morning where parents might be prompting their child to wake up multiple times. There might be arguments in the morning about whether the child is going to school. We see a lot of tears and big emotions, coaxing a child into the car, out of the car, and into the school building. And then what this often looks like at school is a child who leaves class early or kind of refuses to go into class or makes frequent visits to the counselor's office or nurse's office or spends a lot of time in the bathroom. And so I imagine many of you are here today because you've experienced this kind of situation. And as you know, it can be really, really challenging for everyone involved. And so, for the purposes of this webinar, we're going to talk about recommendations for school avoidance that's related to anxiety or OCD. So, we know school avoidance can happen for all kinds of different reasons. What we see here at InStride most often is school avoidance that's related to anxiety or OCD. And so there's this really great analogy that one of the experts in the field of school avoidance, his name is Dr. Jonathan Dalton, came up with, which is that school avoidance is like having an allergic reaction to a casserole. And so I want you all to imagine that a child eats a casserole and then breaks out in hives. So we probably wouldn't say that the child is allergic to casserole. Instead, we would want to kind of look at each ingredient in the casserole and figure out what specific ingredient actually led them to break out in hives. And so we kind of think of school avoidance, understanding it and intervening in it in a similar way. School avoidance is a behavior that occurs because of some kind of specific fear or anxiety that's related to the school environment. And so usually when we want to first start address it, we want to figure out what is it about school or the school environment that's leading to that school avoidance. And so from the perspective of anxiety and OCD, there are a lot of different things that we might think about that can trigger school avoidance. And so the first one is separation anxiety. So if a child or teen has fears about separating from their parent or caregiver, or fears about something bad happening either to themselves or their caregiver, we can see that sometimes lead to school avoidance. Also, emetophobia, or a fear of vomiting. So here, these kids might have a fear of throwing up in school, or might have a fear of getting nauseous and then getting sick in the school environment, or maybe a fear that someone else in the school will get sick or throw up while they're at school. So we tend to see avoidance of school for those reasons. We certainly see it tied to generalized anxiety. So here, these are kids who might be worried about getting certain grades that don't meet their standards, or not doing as well as they want to on tests, or worries about getting into college, or not doing well in school. We also see school avoidance related to OCD. So, particularly if there are obsessions or compulsions that might lead to school avoidance. And then social anxiety is certainly a really common one. So here we see kids who are feeling anxious about being judged by their peers or by adults, might feel anxious about giving presentations in class or participating in class. Sometimes those less structured and social environments, like walking down the hallway or finding a place to sit at lunch, can lead to anxiety for these kids. We might see it related to panic or agoraphobia. So these are kids who are worried about having a panic attack in the school environment, or who might be worried about being in one building or a confined space that they may not be able to escape. And then in addition, we often see school avoidance tied to depression. And so sometimes depression is already there, although a lot of times with school avoidance, what we see is these kids are out of school, they're isolated from their peers, maybe they're not doing enjoyable activities that they typically really like, or they're kind of lacking structure in their day. And so for these kids, sometimes depression can creep in addition to the anxiety that they're already experiencing. And then we also think about co-occurring learning differences. So things like ADHD or dyslexia or learning disorders. It's really common for these learning challenges to also intersect with anxiety, and that can lead to school avoidance. And so, again, as you can see here, there are a whole host of factors that can lead to school avoidance. And so this is usually where we want to dig in from an anxiety or OCD perspective. All right, so now I want to talk a little bit about what maintains school avoidance once it's happening. And what we tend to see is that it can snowball really quickly. And so we think there are a couple of factors that play a big role in maintaining school avoidance once it starts. But the first one, like we just talked about, is school is anxiety provoking in some way. So something about the school environment is uncomfortable or distressing or creates some kind of fear or worry that leads the child to want to avoid being in that situation, which makes a lot of sense, right? If something causes us distress, then we would probably want to avoid going there. And in psychology, from a behavioral perspective, we call this negative reinforcement. So by not going to school, the child gets relief from whatever those stressors are in the school environment, and that can reinforce those school avoidance behaviors over time. And then not only that, but school avoidance often gets worse the longer a child is out of school. So the work piles up, the classroom kind of moves on. Kids worry about what other students will ask or about where they've been if they return to school. And so all of these things can make the anxiety and fear even bigger, which is why we say that it does tend to snowball quickly. And that being said, it's actually not just that school is uncomfortable or anxiety provoking. There's another really big factor here, which is that often for these kids, home is feeling really comfortable. So when a child is home, they may have access to things that make them feel better. Home may feel like a really safe space. They might have access to things like electronics or preferred activities, access to time with their parents, which can all be really reinforcing. So there's also this positive reinforcement factor or gaining something good and comfortable that can help keep school avoidance in play. So we as adults experience this ourselves. When I finish the workday, I might have every intention of going to the gym. I know it'll be good for me. I'll feel better afterwards. It's kind of in line with my long-term goal of staying healthy and being strong. And we also know that going to the gym means pushing my body and exerting myself, and it takes a lot of energy. And being home means I get to put on my PJs and wrap myself up in a blanket, have a snack, watch some TV. It's comfortable. And so, unless there's a really compelling reason for me to get out of the house and go to the gym, there's a pretty high chance that I'm probably just going to stay home. And so it's kind of the same for these kids with school avoidance, where a lot of them actually want to go back to school. They might miss their friends, or they might actually really like learning. It's just that the hurdle of anxiety feels really high, and the comfort of home can be a pretty attractive plan B. So we think of these two factors together as being the main drivers of school avoidance. And in order for us to really make progress in treatment, we really want to make sure to affect both of those factors to get that forward momentum. And here at InStride, we do this by working really closely and collaborating closely with schools, while also working really closely with parents and caregivers. So I'll talk a little bit more about the treatment approach now, because as you all have probably seen, these two factors that are driving school avoidance can be very challenging to overcome. And so the way that we help support students with school avoidance is that it really takes a village. It takes a team approach. And there are three pieces of the puzzle that we think about who kind of make up the team. So the first is the child. It's also parents and caregivers, and then the school. And so thinking about the child, we want to first, or here at InStride, we provide support and coaching to the child. And we usually do that through therapy, with or without medication. And we're really focusing on school reentry first and foremost, because we know that it can snowball quickly. And so what we recommend intervening as quickly as possible with things like exposures, and then other coping skills that can help set the student up for success at school. But exposure is really, and reentry is our primary focus. And then we also at InStride provide a lot of support to parents and caregivers. And this is where we can help get at that home environment. So what we'll often say is we want to make home really boring during the school day. And we do that by working with caregivers to reduce anxiety-related accommodations, or by removing access to privileges, or by making access to privileges contingent on taking steps towards getting into school, while also taking time to kind of meet parents where they're at and validate all of the emotions that come up with parenting a child with school avoidance. And then finally, we think it's really important to collaborate extra closely with school. And here the focus is on creating that school reentry plan, while also providing time-limited accommodations to help get the student back to school. So at InStride, as John said, we work really closely with Bright and Bridge programs to really think through what are those barriers that are getting in the way of a student getting back to school. And that's where we really we lean on the expertise of you all at school who are working with these students every day, and to try to get a better sense of what might be getting in the way, and how can we help them overcome some of those barriers, and get a plan set up. So a lot of times that can be done through an IEP or a 504, but it doesn't have to be. And then I've kind of alluded to this throughout, but another huge part of the team is the treatment team, or so for us, it would be our care teams at InStride. But for all students who are receiving treatment at InStride, we offer a 3-person care team, so a therapist, an exposure coach, and a psychiatrist if interested. And the idea is we're all really working together to help support this student. So I wanted to give a case example here to really make this come to life. So I'm going to introduce this now and then come back to it throughout the presentation. But this is a student who I'm going to call Liam. Um, and he is a 10-year-old boy who, when I started working with him, had missed quite a bit of school. So 55 days in the last year. 30 of which were just in the last month or two, probably 2 months. And so, when I first met Liam, most mornings he was feeling pretty overwhelming anxiety that made it very hard for him to get out of bed. I would say he was also feeling quite depressed. And when he did make it out of bed and out of the house, there were days when it was quite difficult for him to kind of just get to the school parking lot. That was a really big win when we could do that. But even when he would get there, when I first met with him, it was hard to get into the school building. So his parents would often turn around and take him back home. And then on the days when he did get into the school building, he would often leave the class to go to the bathroom, and his teachers would kind of spend a lot of time trying to support him and help him get back into class. But usually what would happen is his parents would be called to come pick him up early. And then in terms of his family, he had really dedicated parents who were both really desperate, honestly, to support their son, but felt like everything they were trying wasn't working, which is a common theme that we hear a lot about. And in addition, unfortunately, they were going through a separation. And so Liam was also kind of living in separate homes, and that just logistically and emotionally made things challenging for the family. So as I go through this talk today, I will keep coming back to this case. So keep this family in mind. All right, so let's talk about assessment and formulation when it comes to school avoidance cases, or kind of how to understand your student's school avoidance. In Stride, this is something that our care teams, our therapists will do in the early phases of treatment, but I think it's helpful for school to have an understanding of this as well. So given those two kind of drivers of school avoidance that we talked about earlier, there are two overarching questions that we want to ask when we're exploring what might be leading to a student's school avoidance. So the first question is, what is the child avoiding at school? Kind of what is it about the school environment that's creating that anxiety and distress? And then the second question is, what is the child gaining at home, or what comforts do they have access to during the school day? This is really the focus of that early assessment. And so thinking about anxiety triggers at school, on this slide, I'll show you a list of some common anxiety triggers that we often present to kids, and then we'll have them check off any that apply. So you'll see things like fears. So fears of things like having a panic attack at school, or being stuck in the building, or germs, or fears that something bad will happen to themselves or to a parent. You might see worries about kind of sensory pieces, so noise in the hallway or smells. You might see worries about grades or feeling like things need to go perfectly. You might see worries about being away from a parent or caregiver, worries about uncomfortable physical sensations that might come up in the school environment, fears about social fears, so talking to peers, talking to teachers, speaking up in class, or presenting in class. Often we see fears about being teased or being bullied by other kids at school. For some kids with OCD, there can be some anxiety about not being able to perform compulsions or rituals at school. And then a lot of kids are affected by just not really having the energy or motivation to go into the classroom. And the list goes on. There are tons of reasons. And then if at the bottom of this slide, you'll also see that there are also contextual factors that may be at play. So for example, maybe a child has a medical condition that requires them to have multiple doctor's appointments that can make it hard to attend school consistently. So we want to think about those factors as well. So for Liam here, we checked off the factors that were affecting him. So first, he was really worried about being away from his parents. That kind of separation anxiety was a big concern for him. He was worried that something bad might happen to his parents when he was away from them. And then he also worried about talking to his peers or presenting in the class. He was also a kid who, the longer he was out of school, the more worries he had about what he would say when he got back to school, when he was asked, where has he been? So you can see there's some social anxiety and separation anxiety at play for Liam. And then the next thing we want to do is assess what are the variables at home that make the home environment feel really comfortable, or maybe too comfortable during the day. And at InStride, we work closely with students and their caregivers to help understand this better. So again, some examples here are things like watching TV or playing video games, spending time with parents or caregiver, running errands, reading in bed, or spending time on the couch, sleeping or lounging in bed, crafting or baking, kind of doing fun projects, spending time in their room, getting to eat foods that they like. And as you can see, the list goes on. But some broader themes that we tend to see here are for younger children, they'll often stay home to have that extra special time with a parent. So this might look like an 8-year-old staying home to cuddle with their mom or have a special lunch. And then for older kids, it's usually more about those tangible rewards. So having access to video games, for example. And again, it can be what we can take care of and help with at InStride is doing this assessment with both the child and the parents to really get the full picture of what might be making what might be making home comfortable during the day. So again, for Liam, there were a lot of positive reinforcers at home. When he didn't go to school, he loved playing Roblox. That was his favorite activity. And when he didn't go to school, he was able to play Roblox during the day, in addition to playing video games and watching TV. He also, when he was feeling sad, he would spend a lot of time in bed. And then he also got to spend more time with his parents, who he wasn't spending as much time with both parents since he started going back and forth between homes. So that was also a really big positive reinforcer for Liam. And then for older kids who might have a little bit more insight, we can do a self-assessment to help try to understand what's driving their school avoidance. So here we might ask questions like, what do you think is keeping you out of school? Or is there anything about school that scares you or worries you? Or what days are the hardest to come to school? Keep in mind, though, that it's really common for kids with school avoidance to really struggle with this level of insight. Not only are they avoiding school, but these kids are often avoiding their internal experiences in general. And so they may not exactly know how they're feeling or what these factors are. So don't get discouraged if this approach isn't super effective. That's very normal. You can use the checklist approach. And then we just wanted you to be aware of this standardized assessment tool. It's called the School Refusal Assessment Scale. This was developed by Dr. Christopher Kearney, and that can help you understand your patient's school avoidance better too. All right, so let's talk about gradual school reentry. So once you've completed your assessment and have a really solid understanding of the factors that are driving the school avoidance, then we can focus on school reentry. And so before I jump in here, one point that I really want to highlight about our approach at InStride is that we really prioritize school reentry in treatment. And what we mean by that is that that's going to be the goal first and foremost, because we know that that's the most important thing, is really helping the student get back into school. And so sometimes there's an inclination to do other approaches first, like we want to help this child better understand what's leading to their school avoidance first, or we want to give them certain coping skills first. And so that work can kind of happen along the way. What we say is we're really going to try to start working on the gradual reentry first. So there are three kind of key components of reentry. And keep in mind that reentry is often a lot of prep work to help set the student up for success. But it really starts off with a reentry meeting with the school. We'll talk more about that. And then creating a gradual school reentry plan and then putting temporary accommodations in place. So I'll kind of talk about each of these, but starting with having a school reentry meeting. First, we want to meet all together to kind of get the whole team on the same page. So that could include various school staff. Often at InStride, we meet with members of Bright or Bridge programs. We love having you all in these meetings. It could be school counselors, sometimes principals, sometimes teachers, special education coordinators, really whoever is going to be on the ground supporting this plan. And then it also often includes some kind of outside providers like a therapist or a psychiatrist. And then of course the family, so the caregiver or caregivers and the child. We actually really like when the student is included in this meeting. It kind of helps them feel some ownership over the process. We want them to feel empowered, that they kind of have a say in how this goes. And we think that's often how it's most likely to be successful. So that's kind of the school reentry meeting, and I'll go into more details about that in a second, but just high level here. We then want to create a really structured gradual reentry plan. And so I'll show you an example of one of these, but the idea is to kind of set up a structured gradual plan that starts slow and builds on itself, similar to a typical exposure hierarchy, if you're familiar with that. And it can be hard to go gradual because there's often a lot of pressure on everyone involved. Certainly, school, there's pressure on the family to get the child back into school um, because the student is falling behind. And so um, that said, we often think about the metaphor of a marathon here. So imagine that if I wanted to run a marathon, but I'm actually, you don't have to imagine. I've never run a marathon and I'm not a runner. So this will be a real life scenario. Just imagine that though. If I signed up for a marathon next weekend, I can assure you that it would not be very pretty. It would be painful and I would not finish the marathon, not even close. So, what's a better way to train for a marathon? You do start by walking 2 miles, and then maybe you run 2 miles, and then four, and then eight, kind of working yourself up. It's kind of the same thing for kids going back to school. So it can feel like a marathon to get back to a full day of school. So we want to start small and then gradually work our way up. Um, we don't do this over years. It's time bound, and I'll talk more about what that timeline can kind of look like. But again, we're gonna do it gradually. And then as part of this, we'll also clarify the details of the school reentry plan. So who's involved? How much is the counselor involved? How much is a preferred teacher involved? How much are parents doing on their end? And what particular steps will they be included in? And again, I'll show you an example of this, but these are all kind of the details that we want to iron out together. And then setting up these temporary accommodations. So I'll talk more about this, but this is kind of working with the school to figure out from your perspective, what can we do to help make school a little bit more approachable for the student in the short term, just in order to get them back into the building. And again, these are temporary. So we don't want to set up these accommodations forever. It's just in the beginning when we're helping the student get back to school. I'll give you some examples of what those could look like. So now let's talk just a little more detail about that school reentry meeting. So again, this is an opportunity for everyone to kind of come together and make a plan. Ideally, that would include school staff, parents, the child, so that everyone can collaboratively make a plan and be on the same page. That being said, we know it's often challenging to get the child into school for this meeting, so there can be flexibility there, having the child join virtually or meeting after school hours if that's at all possible when the child might feel more comfortable getting into school. And then here are some items that might be on the agenda. So kind of the what of the school reentry meeting. So it includes things like making the reentry plan. Today we'll talk about a 10-day reentry plan. So that's kind of a shorter term plan. But we can certainly make adjustments there for each student. And then clarifying the school kind of schedule and expectations. So in the plan, you really want to be specific about what are the expectations for arrival or departure, or for things like participation in class at each step of the plan. And then we also recommend establishing a school point person. So this would be kind of the go-to person who would be part of the team to help work together on implementing this plan. And then you also want to come up with a plan for missed work, which we'll talk more about. These are kids who, especially the ones who have been out for a while, have often missed a lot of work, kind of feel like it can be a mountain getting back and overcoming all of that work that they've missed. So we want to set up a plan to set really clear expectations about what we'll have them do to make up for missed work. Let's see, we've got a plan for communication. So since communication is so important, we want to get really explicit about what communication will look like. So how will we communicate? How often will we communicate? Will it be phone, email? Will we do meetings? Is it a shared kind of Google form? How will we communicate about bumps in the road? All of those details we can help iron out. We've got a reward plan on here. So in order to help improve that motivation to get the student back to school, we can talk about whether there are any rewards that might be helpful. strategies during the day and a cope ahead plan. So, as we've mentioned, returning to school can be a really bumpy process. And so, we really want to think ahead of time about how you'll help the student cope ahead for those bumps that we expect will happen. And so, we'll go over that cope ahead plan. And then we recommend just leaving some time for questions just to make sure everyone is aligned. So that's the what. We've also got the how. So again, we recommend meeting live if possible, establishing hope. So oftentimes these meetings involve bringing people together, and it's common and normal for people to feel discouraged or hopeless. A lot of times people joining these meetings have felt like they've tried everything and it's just been a really difficult process. And so part of the meeting is really holding the hope that we have a plan, we have steps that we can follow and a plan in place, and we'll work together as a team to support this student. And then again, just kind of coming up with a plan for iterating the plan as things go along, because we know things don't always go as we expect they will. All right, so now let's talk more about creating the actual reentry plan. So the idea here is that we want to slowly support the child in approaching school rather than avoiding. The reason for that has to do with this cycle of avoidance. So anxiety and avoidance, we talk about them like they're best friends. It's a vicious cycle, and we want to help students break that cycle in order to help them get back to school. So I want you to imagine that there's a child who's afraid of dogs. And if they're walking down the street and a big dog comes toward them, what might they do? If they're afraid of dogs, they might think, I'm going to get bit by the dog. And then they might cross the street and try to get away from the dog, right? Right after they do that, they probably feel relieved. Maybe their heart settles down. They might have a smile on their face. And it's so hard because we know in that moment that when the child is avoiding, they're feeling so much better. And if the caregiver's with them, often caregivers are feeling better too, because everyone gets relief. But the catch is that then the child doesn't get to learn that they can actually handle being around dogs, and that the worst case scenario, like the dog attacking them, is probably not actually going to happen. So the same thing is kind of true for school avoidance. The urge to avoid school is totally understandable. When the child avoids school, they get relief from things that bring up a lot of anxiety. And in the long term, they don't get to learn that maybe school isn't as bad as they think, or maybe they can handle it better than they realize. So this cycle of avoidance is something we like to explain, and it's exactly what we want to change when working with school avoidance. So here's a sample school reentry plan for Liam. And so again, as you can see, when we were creating this plan for Liam, we worked really, really closely with his bridge program. So I was talking to kind of the point person in his bridge program, and we were really working together to think through, okay, what steps, how can we break this up for this student? What's logistically feasible for you all to do? Because we know that school is extremely busy and has a lot to manage beyond just this one student. So we're really working together to come up with a gradual reentry plan that's both clinically appropriate for Liam and also logistically feasible for the school. And so there were a lot of mini steps involved. This is kind of a snapshot, but it started off at the bottom where it says start here with adding some structure to his mornings, because he was really spending a lot of time sleeping in on school days. So even just getting back into a school routine was pretty challenging for Liam. So what we had him do was get up in the morning when he would normally get up for school. We'd have him take a shower, get dressed, eat breakfast, sit at a desk, and do some work just like he kind of would for a normal school day. So basically a structured school day at home. And then once he got back on that school schedule and was back on a good sleep routine, that's when we started making contact with the school. So this is where we could really start to collaborate with school and the bridge program. So the first step was kind of, oh yeah, John, I see you raising your hand.
Oh, thank you, Maya. I was wondering, and I do appreciate you just let me like jump right in. Like
Yeah.
when I look at this slide, private room at school for asynchronous work, like I'm reading that as it's like such a almost like wow, that seems like a luxury. And at the same time, I'm like, well, not really, not if you've thoughtfully planned for a bridge program, a Bright program, the Bright model out of Brookline Center. Like that to me feels like, oh, well, we've thought about that. We've like explicitly planned around students needing a space like that as they transition back to school. So just wanted to kind of flag that and also just curious about like the degree to which the InStride staff is interfacing with that bright person and like what does that look like and how does that like shared planning happen? So thank you so much.
Yeah, of course. It's a great question and a really important point here. And we know that not every school is going to be able to have a private room set aside for every student who's avoiding school to do schoolwork. So, like you said, we're working really closely with the point person at Bridge. So for this student, it started off with me. I called I got the name of the point person at Bridge from the family. They signed a consent form for me to be allowed to reach out to them. We kind of explained our rationale for working really closely with schools and why that's such an important part of this work. And then we reached out really that first week. And in that first meeting, I'm kind of talking to the point person and getting some information from them and hearing from them what they're seeing and what some of the pain points for them have been. And then as we get the ball rolling with treatment, I'm really checking in with that bridge person as often as they're able to. We come up with a plan together about what will work for them, and it's different for every school. But for this teacher, we were probably checking in for 10-15 minutes once a week in the beginning. And then we worked together to create this school reentry plan based on what was feasible for their program. So actually, when it says private room for this student, that actually meant going to the bridge program to do work, just like you said, John. Yeah,
No, that
exactly.
that is so incredibly helpful, and it just again it emphasizes for me that like when you make that investment in a reentry process or a process by which we're supporting students with a truly a tier 3 programmatic general ed intervention like Bright, that it allows for the in-stride work to happen somewhat seamlessly. So I appreciate you indulging me here.
Of course, of course. Yeah, no, I really appreciate the questions. Um, Yeah, so just to kind of wrap up on this slide, the idea is that we're gradually helping the student get back into school. And so that might start off with just driving to the school building and sitting in the parking lot. It might lead to meeting with the school counselor for in person for 15 minutes to play a fun game. Liam really loved playing Uno with his school counselor and with his bridge teacher. So we'd have him go in and play Uno for 15 minutes and then go home. And then it might be, going to bridge for a certain period of time, starting to get into preferred classes, and then gradually building in non-preferred classes until we can get students back to the full day. So, there are a lot of hiccups in here. It's not always easy, but this is kind of the idea. I'm going to skip this one real quick and go here. So, in order for the school reentry plan to be successful, there are a number of steps that we want to take with the school and the child and the family to kind of lay the groundwork for school reentry. We want to kind of get these ducks in a row, so to speak, before starting the school reentry process. And so one of those things is to kind of work with school to see if there are any temporary accommodations or strategies that will help the student just get into the building. And we kind of divided these up into 4 buckets. So the first is modifying the schedule. So here we can think about things like modifying the start or leave time, or beginning the day with something that they actually like a preferred class or an activity. We also talk about adjustments to assignments that may be possible. So this could look like work forgiveness so that students aren't returning to a mountain of work, but really just having a very clear plan in place for what the missing work is and what the expectation is for making that up. We also talk about in-class accommodations. And again, these are time limited, temporary, just in the beginning to help get the student back to school. But this could be things like having the child pick a seat in the classroom, having them leave a minute or two early if the chaos of the hallway is a challenge for them. It could be agreeing to voluntary participation in class versus cold calling, things like that. And then some other strategies. So making a cope ahead plan. This is something we do with the kids and their families to really think through what is going to be challenging for this student when they get back into school and how can we cope in advance in terms of how we'll help them manage those situations. And then any kind of rewards. We talked about a reward system, but for following on that. All right, we talked about a plan for missing work. So here's kind of an example worksheet that we use to help just specify what the missing work is and whether there will be any modifications to the work in terms of what they're expected to do, the due date, and whether it was completed. And then I mentioned the COPA head plan before, but here's kind of an example of what those COPA head plans look like. So again, the purpose here is to think about what situations will be difficult at school and then decide during a calm moment how they'll cope with them. And so here we're helping identify those bumps at school and then talking through some skills and strategies to help manage them. So I actually saw a question in the Q&A about what kinds of coping strategies do we teach, and I'm happy to talk more about that. We also put mantras on here and then some reasons why. So along the lines of mantras, it's just helpful to help the student come back to the why. And this can be such hard work. And so it's really helpful to ground it in what matters to them. And then this isn't on here, but I would also definitely add that it's great to talk about or to kind of cope ahead for what you'll do if the student has the urge to leave school. So, and they want to go home. So, are there any steps we can add in between? Would they take a break? Would they get a drink of water? Would they let a teacher know? What would the plan be so everyone is on board? And then what to say when they ask where you've been. So, this is a really common fear, believe it or not, in kids with school avoidance is worries about people asking them, hey, where have you been? I haven't seen you in forever, and feeling anxious about not knowing how to respond. So in Stride, we do a lot of role plays with kids about, well, what would you actually say in this situation to help them really prepare for that situation. I just want to pause before I talk about this slide. I'm seeing a couple of questions in the chat. Thank you so much for sending these. One of the questions is, will these slides be available? And so, John, if that's okay with you, absolutely. I would love to send these slides over if there's a way to send them out. Great. Thanks. All right, so another thing we like to do is structure the morning before school. And so um, a lot of times having a morning routine in place that's really predictable for the child is super helpful. So we want to allow enough time for them to wake up and then leave the house so that things go as smoothly as possible. So how long would it take to kind of wake up and get out the door? And then you want to add in buffer room if things go awry. Then you want to actually map out what the morning routine would look like. So we use this worksheet to help with that. And then there's a nice box here for what motivates you to get out of bed. Again, we really like to tie this work back to what matters to the student and what's going to motivate them to do this, because these mornings are really difficult, as you all know, and it can be tough. And then similarly, we do the same thing with the night before school. So helping them write down, what will settle them at night, what they need to get done before going to bed. Families that I've worked with have found this part really helpful. So just to have as many decisions made the night before as possible. So maybe it's having their clothes laid out or breakfast decided on, their backpack packed. And then we kind of list out the whole nighttime routine and what time they aim to do it. Alrighty, so I'd love to just kind of talk a little more about how we think about supporting parents and caregivers at InStride. This is a huge part of the work. And sometimes, oftentimes we're working as a team with school, but what we hear a lot from school staff is kind of feeling like it's a lot harder to provide support to parents and not really being sure how to do that. So this is a really key place where InStride can come in and provide support, or an outside provider, any kind of therapist. But this is usually what we'd recommend. So first is to establish a team approach between the school and the family. What we really want here is for the child to get that surround sound approach so that all of the adults are on the same page and everyone, including the child, is kind of aware and aligned on what the goals are and what we're doing here. So this can be really hard to do. It's much easier said than done, especially if you're working with parents who have had a hard time kind of forming a collaborative relationship with school. And so we really try to lead with empathy and try to approach problems collaboratively. Um, and then the next tip is to validate difficulties and challenges. So something that we do with parents and caregivers is pay attention to parent emotions. So what we often see are parents and families who are feeling defensive, or they might be feeling really anxious, or they might be feeling really frustrated or discouraged or helpless, ineffective. A lot of times the families we're working with will say, I feel like I'm the only one. I'm the only one whose child doesn't just run into school happily. And that can be really difficult for the child and for the parent. And not only are they feeling alone, but they maybe actually aren't getting as much support or community around them. It can be really isolating. And so it can be helpful when you're working with families to lean in on some of that validation, lean in on acknowledging and empathizing with their difficulties, reminding them that it's not their fault. And then the next tip that we do a lot is to help support parents in helping their child face their fears and kind of take those gradual steps to get back to school. So at InStride, we use a framework called PEER to help parents respond effectively to their child in moments of distress. But what PEER stands for is P is for pause. So this is just pausing and observing their own reactions, and that allows them to respond thoughtfully instead of responding kind of reactively. The first E is express validation, so kind of acknowledging their child's emotions, even if they don't agree. So I it makes sense that you're feeling really anxious right now, is an example. And then the other E is we want parents to encourage brave behavior by gently motivating them to take small steps forward. So we want to combine those two E's, express validation and encourage brave behavior. So what that looks like is it makes sense that you're feeling really anxious right now. And I know you can do this. What's one small step we can take together? So again, we are helping parents to help encourage their child to take those steps towards getting back to school as well. And then the R in the peer model is reinforce. So that's reinforcing any brave behavior by paying attention to it, by praising it, or by using some kind of reward or by using some kind of reward system to really help encourage whatever progress they're making. And then the last tip is to make home less comfortable during the day. So I talked a lot about that earlier in this presentation, but that's something that we do a lot with families. We really can't say that enough. And so we like to think of this as a way that we can help support school is by helping support the home environment. So we come up with a plan of what all of those comforts are at home, and then we come up with a structured plan for how to reduce those. And it can be tough. I mean, there's a lot of problem solving that goes into this. Like, how do I remove Wi-Fi when I work from home and I need Wi-Fi? So it's definitely difficult, but we work with families really closely on how to do this. Alrighty, I want to make sure I have some time for questions here, so I might um, I might move us along here to one more slide, which is just some key takeaways. So some of the main things that we want you to take away from this presentation are one, that addressing school avoidance is difficult and it can take time. And with kind of a team approach and the right tools, It can happen. We've worked with lots of students, particularly when we have that team approach, when we have schools who are interested in working together with us, when we can all be kind of on the same team, um, it can be effective. And so that's kind of one takeaway, and that goes into the second one, which is that a team approach is really key here. The next is that reentry should be structured and gradual. So I showed you some examples of different worksheets that we use. These are real examples of worksheets that we use with kids and families and schools. And we like things to be kind of structured and written down and also gradual. And then the two ways we do it are number one, to kind of reduce barriers to school reentry. So mapping out what are some of those aspects of the school environment that are bringing up anxiety and leading to school avoidance. We like to work with schools to help with that and also kind of get the school reentry plan in place and get some of those temporary accommodations set up. And then also shifting the home environment. So working with parents and caregivers to remove comforts at home. And that's kind of the treatment approach that we recommend. So a couple of resources for you all. I would recommend the top one since I'm guessing most of you are school staff. This is a really nice book on helping students and their families who are experiencing school avoidance. If you have parents though who are interested in resources for a parent or caregiver, the bottom book is excellent as well. All right, so thank you all so much. I know we have a couple of minutes left, but I really appreciate being able to speak with you all today. If you have any questions at all, I put my email address here, and our website as well, if you're interested in learning more, but please don't hesitate to reach out to me. Really happy to help. So John, I'm happy to answer some questions with the last couple minutes or however would be the best way to use the time.
Yeah, we definitely have some questions in the Q&A that I think would be great to hit. And before we do that, I just want to express incredible thanks to you, Maya, for a phenomenal presentation and hitting a topic that is very complicated and that requires lots of attention and coordination, but that I think, very thankful for the thoughtful approach to how we can address school avoidance in a way that will lend itself to some success for kids that are really struggling and families too. So I'm just looking in the Q&A. Megan's looking for interventions when students have been explicitly taught coping strategies like mindfulness, progressive muscle relaxation, cognitive reframing, but says nothing works or helps. So like kind of that like I've done it all, but it just doesn't seem to be working.
Yeah. That's a great question, Megan. A couple of thoughts come to mind. So, first would be to kind of normalize this actually, that we work with a lot of kids who learn a lot of coping tools, and it's really normal to kind of feel like the things I'm trying aren't working at first. And from there, we kind of get curious. So, I would ask some questions about which tools have you tried? How often have you tried them? What's kind of not working about them? And then I would just give some education just about this idea that we're creating a toolbox here. And so we're going to give you all kinds of tools. Some of them might work and some of them might not be as effective. And let's try to get a couple that work the best for you. And then you can also say, that these things take time. Sometimes when we first start practicing these tools, they aren't as effective. And the more we practice, the easier it gets. So that's another piece you can do too. But I'll also just say for you, especially for these kids experiencing school avoidance, it can be really hard for them to find coping tools that work for them. And that's why, as I said before, we really focus on school reentry first and foremost. That is really the key ingredient. That is what's most effective in helping these kids get back to school. But it's a great question, Megan.
Thanks for that, Maya. And progress does not happen in a straight line, right? Like so to give
Got
that
it.
perspective that you have a day that is moderately better than your previous day. It will not be perfect, but better is better.
Yeah.
Um, I'm seeing, do you use the SRAS? I know you talked about that. That's a tool that we've used as well, Megan. So, certainly happy to chat with you about that. And I want to honor the time here. We've got about a minute left, and I know we're not going to get through 3 or 4 questions. Any possibility, Maya, for these to be maybe addressed in a follow-up? And I know that they can email you as well. Is that possible? Okay.
Absolutely. My email address is right on this slide here. Please don't hesitate to send me all of these questions. I'm really happy to email back or set up a time to talk more.
That's great. Well, then, probably a good time to just make sure that all of you can get to where you need to go after what was a wonderful presentation. Maya, thank you so much. Really sincerely appreciate you and InStride Health for joining our consortium meeting and being a part of really broadening the set of approaches and strategies that we have for kids across the state. And for all of the attendees today, what a wonderful showing. We had almost 100 people in attendance. And I am incredibly grateful for all the work you do on a daily basis. We will have some announcements coming up for some more virtual convenings, so please keep an eye out for that. And I am incredibly grateful for all of you. I hope you have a wonderful day. Take good care.
Thanks so much, everyone.